Hey, welcome back again, viewers and subscribers. This moment, I want to be speaking to you on uterine fibroids and the link between hormones, estrogen and progesterone in the development of uterine fibroids, as usual, owing to evidence-based research. And I am focused on the plant Chasteberry Vitex agnus, which is customary used to balance the hormones and also aiding in fertility issues. The seeds are which are utilized by herbalists, right? To usually make a tincture, which is where you place either the leaves, the seeds, or the roots in spirit or ethanol. You leave it to macerate, to soak for a few weeks in a dark area in mason jars, and then after that it'll be strained and it will be dosed in a dropper, placed under the tongue, delivered sublingually, which arrives in the bloodstream very quickly, as the same as intravenous route via the veins. It's also called Abraham's balm. What a beautiful plant. As I said in previous videos before, I was blown away when I was in the UK studying herbal medicine. I saw the tutor standing next to this huge plant, and I was like, man, that time I was doing herbal tradition course, and I was like, man, that's pretty huge. That's how big this plant usually gets. I first found it at a vegetable market here in St. Vincent. As usual, when I just started my YouTube channel, I was curious about all these plants, just taking pictures, looking them up on my plant app. You know, the journey, it's serendipitous, right? One thing leads to the other. There are no such things as coincidences. But anyways, right? So it has always been postulated that estrogen actually plays a role in the development of uterine fibroids, also called Meiyomas, right, which are non-cancerous, non-benign. If you get fibroids, chances of developing the cancer not likely at all, but it also disrupts life of many females. It's 3 times more prevalent in blacks than whites. And I found something quite interesting while reading. They say that after a menopausal stage, right? Um, that's sorry. Before menopause, right? It Getting fibroids is more active, right? You're more prevalent to get uterine fibroids, right? It's actually from the age of 30 to 50, right? During reproductive stages, right? You're more likely to get uterine fibroids. But when menopause arrives, that's when they shrink. That's when your body stops producing these hormones, really. And what I found is that they gave hormones to black women who were postmenopausal, in the menopausal stage, and they found that the fibroids came back, but they gave it to Caucasian women, white women, and who in postmenopausal stage, during menopause, and they found that, well, the Caucasian women didn't get fibroids. So I don't know if it's just something about us blacks, something about us. And also I found out that if you have multiple pregnancies, you're less likely to develop uterine fibroids. If you've never gotten pregnant before, right, you have more chances of developing fibroids. If your sister had fibroids before, your mother had fibroids, right, you will most likely develop these fibroids. And treatment depends on the size, the location, right, and your preference. Actually, these fibroids, which develop within the uterus or outside of the uterus, right, they are prone to hormone influence. But progesterone, which is produced by the corpus luteum during the luteal phase of the menstrual cycle, has now been deemed from research to actually play a role in the development of uterine fibroids, right? Which progesterone, which helps in developing of the mammary glands, and also for for supporting pregnancy, for the implantation of the fetus, right, in the endometrium, right, and it also has influence in causing preventing cell death, right, preventing apoptosis, and also promoting blood flow to these fibroids, right. So progesterone has now been deemed, right, another hormone, because traditionally it was deemed that estrogen alone was responsible, right. So it's pretty intriguing, right. I've read a lot of articles, read a lot on uterine fibroids, vitamin D, right, can also help in preventing development of uterine fibroids. Green tea can help to treat it. Diet rich in fruits and vegetables can also help in treating uterine fibroids or even preventing it. And while genetics also is another factor that another thing that they're factoring in, right? Um, and if you have watched my other videos, I've listed plants that can help. Even turmeric, curcuma longa, which I found in a 2014 clinical trial, which they gave to the patients after 6 months. Notice their fibroids decreased or even disappeared. Right. So these uterine fibroids, sometimes you don't get any symptoms. Right. They disappear on their own. But like I said, they're more active during the reproductive years. It can depend on their location. It can cause abdominal pain. They can cause urinary retention if they're located where they're pressing on the ureter, right, of the bladder, right. It could cause pelvic bleeding. Could cause anemia, making you look pale and weak. Heavy menstrual periods. For some, they're a nuisance, right. I had a friend of mine who actually had vaginal bleeding from fibroids, and I ended up, and I was advising her that, most likely it's a hormone balance, because she had told me she went and did an ultrasound, and she had one small fibroid. She told me she had excessive bleeding, and then I went on Amazon and I ordered a hormone balance for her, which had black cohosh, stinging nettle, which also had chasteberry, right. I was even also telling her about the plant, and interesting enough, she had a friend who told her, yes, that's the herb I use. I use the pills, and I've never really gotten bleeding ever since. And she had used the hormone balance via dropper, right, droplets in whether tea, whether juice or water, right. And she said, well, my abdomen doesn't feel that full. It's helped me. I haven't been having such bleeding like before. So yeah, comes to uterine fibroids, hormones, yeah, hormones, key factor, key factor in their development, in their growth. Progesterone, in the cells, their proliferation. So yeah, thanks again as always for watching. I hope this was very informative, right. Good then. Thanks again.